what does your company do? And, who's using it, who are the users, and how are you impacting health equity?
Well, Koda helps patients get the kind of care that they want by helping them plan that care in advance. Historically, this is done through an estate lawyer. Sometimes it can be done through a physician, but most patients don't have an estate to lawyer. And most physicians are generally too overwhelmed to play paralegal, which is why planning rates in this country are in the single digits, with minoritized and low socioeconomic status populations being at half of that. So Koda Health is a scalable B2B tech-enabled service for informed decision-making and advanced care planning. We have a patient-facing digital platform that's our one-stop shop for education, decision capture, documentation, and signature support for legal documents like advanced directives and do not resuscitate orders. And it's all integrated into the EMR so that doctors have real-time access. And for high-risk members, we pair them with our Koda advocates, so palliative care social workers, nurses that provide comprehensive support and family alignment as things start to decline. So one of our clients actually published a study in the American Board of Family Medicine Journal that shows that Koda not only tripled their plan completion rates, but we also achieved equal rates of engagement across race, gender, and socioeconomic status. So you don't have to take my word for it. You can go ahead and read it yourself. And at the end of the day, democratizing access to advanced care planning allows more folks to get the kind of care they actually want, including palliative and hospice, reduces family stress, and increases quality of life days outside of the hospital, which I think we should all be entitled to.
How have you really moved the needle with a particular group in your work?
Well, as I said in my introduction, equity of access is a core value proposition in our sales process. But at the end of the day, there's one story that really stands out and is close to my heart. My grandfather experienced homelessness several times in his life. And right now, Koda is being used in unhoused communities where the average life expectancy is 48 years old. These folks haven't seen their next of kin in over a decade. And at the end of the day, they still want the same access to care as everyone else in end of life and serious illness. So before Koda, not a single one of them had an advanced care plan. And in one encampment alone, over 3 months, 64 people created plans. Compared to the general population, they were 10 times less likely to choose a family member as their medical power of attorney. And over half said they'd prefer comfort care over aggressive medical intervention, which is not what we might normally think. So for a group that doesn't often get a say in their healthcare, I think this is a really powerful way to take back some control and allowed me to sort of affirm my own grandfather's personal experience way back when.